Hormones affect our physical, mental and emotional well-being and are often disrupted by a cancer treatment. So disruption to your hormones can impact a variety of different areas, influencing your sexual identity and how you feel as a sexual person. It's common for people to have mood disturbances and changes, hot flushes, changes in their body composition or even features of their body. So hair loss as an example. Lubrication and arousal changes can be affected by a lack of hormones. And then hair changes and hair loss, skin changes and how the skin feels, and lack of sensation as well. But also that sense of desire, that sense of interest in sex. And energy is something that's hugely underestimated, and people can experience a lot of fatigue as a result of disruption to their hormones. People who experience hormone changes as a result of their cancer treatment, their experience is going to be unique to them. So as a younger woman experiencing menopause as a result of treatment, that's going to be a very different experience to perhaps older women experiencing a natural menopause. And that can feel quite isolating when there's lots of information out there related to hot flushes or other changes that people might experience. I'd encourage people to seek support from their clinicians around how they navigate some of those changes and disruptions. For men who are on androgen deprivation therapy, that hormonal disruption is going to have a huge impact on their sense of self. But in relation to erectile function, as an example, men who have erectile dysfunction as a result of a surgical treatment, that's going to be a very different experience for them. And it's important for people to remember that physical treatments might not be the solution in that instance for men on androgen deprivation therapy, because it might be a disruption around their own sense of desire or interest in sex, or fatigue as another example. So seeking out the right support and your own experience is really, really important. There are some practical strategies to help with this disruption in the hormones. Communication is key. Expressing how you're feeling and navigating those mood disturbances or mood changes can be really helpful, particularly with a partner or partners. Some self-care, so spending time with yourself and your body, being gentle, non-judgmental language about your body and how it's functioning. Sexual aids, lubrication, in engaging with new things that might support and replace perhaps some of the things that have changed. And then finally, looking after yourself. So some gentle movement, keeping it hydrated, being well rested before you engage in sexual intimacy is going to give you the best chance of having a more enjoyable and pleasurable experience. For people experiencing hormonal changes, these changes happen over months and years and take time to adapt to. It's really important to seek professional help if you're struggling to navigate the way forward. You're not alone. Often people feel very isolated with these changes and this disruption, specifically to their sense of sexual identity and sexual wellness. But be kind to yourself, be patient, and there is pleasure and enjoyment on the other side.